went to work. My trainer was adjacent to where I worked. And then while there, I was early first, and I had a massive heart attack.
So my cardiologist, pre-interview for the stress test, said there's no point in doing a stress test, you're pretty well blocked. So on Wednesday morning, I had a triple bypass.
Let's check it out, right? You're 39, you don't have any risk factors, you're healthy. And they found my LAD, which is also tagged your Widowmaker, was completely 99% blocked. And they put 2 stents in, and I came out with, you had a heart attack.
When I went in for my checkup, my primary physician, I was explaining to her about my shortness of breath, and she said, well, let's do a nuclear stress test. So we did, and it came back abnormal. So then I had to have open heart surgery.
Heart disease does not discriminate. It affects all. We have had individuals as young as 18 and individuals in their 90s. It affects women and men and all different categories of people.
We all have the same types of surgery or the reasons we're here, but I think we do have a common goal, to get back to normal.
And our goals in the cardiac rehab program is to build strength and endurance to help the individuals resume the regular activities of daily living, as well as other activities. And we hope that they'll gain that sense of confidence, have the reassurance that they will be okay to pursue other activities, regain independence, and be able to resume their regular, normal lifestyles.
The staff and the program, I represented what could be, which was transition from an acute intervention that was life-threatening to physical therapy, rehabilitation, to cardiac rehabilitation, to a normal life.
Cardiac rehab is a supervised exercise plan for patients that have had a recent coronary event or intervention. It consists of exercise sessions. We meet 3 times a week, Monday, Wednesday, and Friday. The average length of the program can be up to 36 sessions, but most individuals attend an average of 20 sessions. And during those exercise sessions, you'll be monitored. We'll monitor heart rate, blood pressure, and your heart rhythm to ensure that you can exercise safely and properly.
The staff at the rehab facility work with you. You're very closely monitored. They are very mindful of what your cardiologist is recommending. So I felt I was in very good hands during that whole process.
I was well supervised in terms of the structure. I had to learn to warm up to exercise, and I had to cool down to exercise. Something that for me was not trained. I had to learn that part.
It's pretty important to do some sort of structured rehabilitation to get you back to where you have the confidence of what you were doing at home is not going to be too much for you after something major like this.
The plans are individualized. So a person that may have been a runner prior to coming to cardiac rehab, by the time they finish, we hope that we can have them on that path to begin that running again. Somebody who has never exercised prior to coming to cardiac rehab, we hope to educate them so that they have a lifetime plan of a fitness routine that they feel comfortable carrying on indefinitely.
Well, it was really a shock because I was very active. I'm a member of the Rex Wellness, and I was going 3 times a week. But I think now that I know the equipment that I've been using here, so I think I'll be prepared to go back to Rex Wellness without any problems at all, because I know how long and what the settings should be, and so I'm looking forward to it.
I think it's very important to gain that confidence back that you're physically capable of doing your normal routine. And I don't go out and run marathons anymore, but I do like to work out in the yard. I like to work in my wood shop, and to be able to do those things, you have to have that confidence that you're not exceeding your limits. And a program like this definitely gives you the assurance that you're well within your comfort zone.
When you first come to class, we mentioned that it is in a group setting. It's a good mix of individuals to have in class, and as I mentioned, we all share stories and experiences.
It is a community, although small, becomes very important. Becomes very important to each other, and becomes very important to make sure that your participation makes their participation meaningful.
Well, I feel like I've accomplished a lot, and I feel like that I've grown stronger, and I think my whole attitude has changed. I have a more positive attitude and know that I can do everything that I used to do, because these group of ladies have encouraged me, and I don't think there's anything that I can't do now.
I've lost about 55 pounds, changed my diet completely, and I feel pretty good. And I don't notice too many limitations from my heart failure, and I have pretty significant heart failure.
The program is what gives me that assurance that I'm on a path to recovery that is going to bring my life back to as normal as it can be.
And that's what you learn about yourself. You only have time. And how you choose that time is your gift back to the world.
Life is so fragile, and what matters most is what's lasting, your family, your loved ones, your friends, making a difference. That's what's important, not living in fear. Even if I'm worried, I have to live life. And that's what I tell myself every day. I have to live. And that's what it's about for me, is finding my purpose. And if I can help one person let go of some of that fear, that's huge. To me, that's a win, because that's what so many people have done for me already.